Hey there, dental enthusiasts. Welcome back to my channel. In today's video, we're going to share 2 valuable tips for successful buccal restorations. Hey, this is Ash from All Things Dentistry, the place where we're passionate about sharing those unwritten hints and tips of dentistry. Let's jump into it. Tip number 1, using Teflon to enhance visualization. The first tip is an absolute game changer when it comes to buccal restorations. To aid in visualization and prevent hemorrhage, we recommend using a strip of Teflon. I used to use cord or absolutely nothing at all, but then the gingiva would become irritated from my rotary instruments and the overall procedure would slow down. Simply pack the Teflon into the gingival sulcus to gently push away the gingiva from the decayed area. This technique not only improves visibility, but also speeds up the restorative process. However, during the procedure, we encountered a minor problem. The patient experienced some discomfort while we were packing the Teflon. To ensure their comfort and achieve better hemostasis, I elected to provide local anesthesia to the keratinized tissue. I had previously administered a local infiltration anesthesia, which is usually sufficient, but for some reason we needed to provide a little bit more. I prefer to use a diamond high-speed burr to remove restorative material and tooth structure, as it is a super smooth procedure. I'm watching to see if I need to remove the entire restoration or retain the portion that is still serviceable. You know, each time we remove restorations, we remove just some more tooth structure, and I want to preserve as much tooth in each situation. But sometimes less is not more. As we progress with the procedure, I gently remove the decay with a slow carbide round burr. However, I encountered a funny incident that I'm sure you can relate to in other facets of dentistry. The pesky round burr got entangled in the Teflon, causing a minor hiccup. At this point, I want to ask you, our viewers, what type of cord packer do you prefer to use? Unfortunately, I didn't have one in my operative kit, and I elected to use a periodontal probe. Let me know what type of cord packer you like to use in the comments below. Okay, I've removed the decay and the tooth is ready to be restored. I'm electing to use a resin-modified glass ionomer restoration in this situation. Tip number 2.
Hey, Ash here, and I wanted to take a second of your time just to introduce our course, Root Canal Like an Endodontist. We've had it for a couple years, and we've had some amazing successes through it. Just confidence building on behalf of our students. And really, what happened was, a few years ago, I wanted to create a course to help others because I know what it's like on your endo journey. A lot of times, you don't know what's going on. You don't know if you've ledged it. You don't know what to do if you blocked it. You don't even know if a curved canal, what to do. And what I wanted to do was take all my mistakes and my training from my residency and put it into a affordable online course for everyone around the world to join in. And it's been absolutely amazing. And I wanted to offer to you, check us out at allthingsendo.ca. Once you join the course, you get access into our private Facebook group where all of us answer questions. And I'm telling you, there are questions every day that you might be able to, I'm sure you'll be able to connect with, because sometimes it just takes a little bit of courage to ask a question and then your outcome may be incredible. Anyways, I look forward to seeing you there. allthingsendo.ca. We'll talk to you soon.
Tip number 2, white stone to shape restorations. To shape and sculpt the restoration, I prefer using a high-speed white stone spinning at 200,000 RPM with water. This technique helps me remove excess restorative material without compromising tooth structure. The flame-shaped white stone is incredibly useful, especially when working in the gingival sulcus. It also minimizes bleeding from the gingiva. Lastly, to ensure the longevity of the restoration, I apply a fluoride varnish. You can use any type of coating, but I prefer this one. This coating prevents water absorption over the next 24 hours. And there you have it. The buccal restoration is complete. I remove the Teflon from the gingival sulcus, and voila. I hope these tips have been helpful in your journey as dental professionals. Remember to share your thoughts and experiences in the comments below.